I'm Dr. Christopher Sendi with Nova Health Recovery Ketamine Infusion Center, and I'm going to discuss ketamine-assisted psychotherapy. Ketamine was developed in 1962 by Calvin Stevens, and ketamine is related to phencyclidine, or PCP. And they FDA approved ketamine in 1970 for anesthetic purposes because it was so safe and effective as an anesthetic. And it was basically very effective at preserving cardiovascular status at higher doses. So basically, patients' respirations and heart rate were maintained effectively, and it was a very safe drug. In fact, it was placed on the essential medication list for the World Health Organization in 1985 because of the safety and efficacy of ketamine as an anesthetic. Now, ketamine does produce dissociative and a hallucinatory state known as an emergence phenomenon. There's vivid experiences with altered states of consciousness depending on the dose of ketamine. And ketamine has been found to be safe and effective in numerous settings, not just the OR, but also in pain management, and also more recently in mental health. In fact, the safety and efficacy of repeated dosing IV ketamine for treatment-resistant depression was evaluated by Anne Roth, and that was in 2010. And they determined that basically repeat dose IV ketamine for treatment-resistant depression was not only effective for the depression, but extremely safe. Now, how ketamine works is really a complex topic, but just as a real simple explanation, ketamine is an antagonist of the NMDA receptors, and NMDA receptors are present throughout the cortex and central nervous system and peripheral nervous system. And these are glutamate acting receptors. Glutamate basically turns on NMDA receptors, and this is involved with the process of learning and pain. An excess activation of NMDA receptors is actually neurotoxic and causes the breakdown of neurons and neuronal death, as well as inflammation. And so basically ketamine modulates the glutamate system. It blocks NMDA receptors, and it prevents this excess excitation from glutamate. And so effectively, when ketamine does this, it also impacts a number of other neurotransmitters that are downstream, including the kappa opioid receptor, the GABA receptors, and also the cholinergic neurotransmitter systems and monoamine systems, serotonin and dopamine. And also, when ketamine is introduced, really what it does is it causes this brief glutamate burst at key neuronal areas that results in the production of neuronal proteins, in particular brain-derived neurotrophic factor, which is like fertilizer for the brain, if you want to call it that. And this results in the formation of proteins through mTOR. And these proteins cause dendrite formation, which are little tiny knobs on nerves. And that's where synapses form. And synapses are important for neuronal connections and neuroplasticity, which is what's missing in chronic stress and depressed states. And so basically systematic reviews of ketamine demonstrate its efficacy in treatment-resistant depression. But they always talk about the adverse effects, and these are like derealization, depersonalization, and drowsiness and dizziness, that somehow it's a problem, but in fact they're probably part of the therapeutic process, and that's the way they should be looked at. And so effectively, this whole concept was brought up as well by McGurr and his group in 2015, looking at a systematic review and meta-analysis of ketamine for treatment-resistant depression, and the studies that they looked at showed ketamine to be very safe, effective in treatment-resistant depression, but that really these adverse effects are probably part of the therapy itself. Now, ketamine has got an extremely long timeline. A lot of people kind of relate to the Berman study in 2000 as being where ketamine got placed on the map for depression treatment, but actually ketamine was used as early as 1972 by Khorramzadeh and Lofty in Iran, and they used ketamine with their patients along with psychotherapy in an abreactive fashion to treat their patients. And then in Argentina in 1974 with Fontana, also ketamine was evaluated with therapy. And then in the 1970s, Salvador Roque in Mexico utilized ketamine therapies along with LSD and a number of other psychoactive agents with basically a bunch of sensory overload in the form of psychosynthesis to treat patients with mental health disorders. Actually, Salvador Roque ended up in jail for several years in Mexico as a result of part of these treatments. And there were further studies with evaluation for ketamine for depressant activity by Sophia and Harakel in 1975, and then Sappington's group, where they used ketamine-facilitated fear-induced anxiety therapy. And then also Krupitsky, who used ketamine therapies for psychedelic psychotherapy for alcoholism in Russia, and did it on quite a few patients, and this started in 1985. So there's a long history, even before Berman and his group did the initial small study on ketamine for treatment-resistant depression. Now, as far as the ketamine for medical treatment of mood disorders, we knew that ketamine had antidepressant effects in early practice, and it's been given intramuscularly in a number of different psychiatric practices over the year in small areas. And ketamine was also evaluated in 1994 by Crystal and his group just to see about the mood and perceptual changes that basically happened with ketamine administration, almost like a schizophrenic, psychotic type behavior. But in Berman's study in 2000, they used a protocol of 0.5 milligrams per kilogram over 40 minutes. And it was noted that there was a rapid decrease in depression, but the effect was short-lived. And what they found over time was that increasing the dosing and frequency was found to extend the benefits of treatment-resistant depression. And in a cousin and her group in 2012, they actually used intramuscular ketamine to maintain the efficacy of ketamine for treatment-resistant bipolar II depression. And then Onrot in 2009 used multiple dose IV ketamine for treatment-resistant depression and showed that that was a good way to extend the benefits of basically ketamine's effect. Now, we also had mentioned earlier about Culp and his group using ketamine-enhanced psychotherapy in treating death anxiety and anxiety-type disorders. So basically, ketamine mixed with therapy and frequently used as infusions can actually prolong the effects of ketamine in terms of mood disorders, and later on we'll discuss even addiction. So the administration of ketamine can be done by a number of routes: intravenously, intramuscularly, intranasally, and sublingually. Now, IV is the most bioavailable form. It's 100% bioavailable. IM ketamine is 95%, and intranasal is 30%, and oral ketamine is 20%. Now, if any gets swallowed, you can sometimes have this later onset of ketamine effect. And the problem with IM ketamine is that the length of time that it can affect the person from a dissociative state is a lot longer than IV ketamine, where basically it turns off real quickly once the IV pump is turned off. Now, intramuscular and sublingual ketamine are certainly great considerations for ketamine-assisted psychotherapy because they can be used in an office setting, and the therapist can be present and perform psychotherapy in a less medicalized setting. And there are a number of small studies demonstrating sublingual ketamine in chronic pain states, for example, and also as a way of stabilizing mood and antidepressant effect by Laura and her group in 2013, where they used low-dose sublingual ketamine in unipolar and bipolar depression, and also found that it was pro-cognitive, meaning it was allowed the person to think clearer. And of course, then there was a study by Chilakuri in 2014 in India, and they demonstrated intramuscular ketamine could certainly have acute antidepressant effects, just like IV ketamine. Now, altered states of consciousness are frequently vilified by many because it just seems like a bad thing. It seems like people shouldn't enjoy themselves or shouldn't be altered because that's bad, and that basically it's an unneeded psychedelic experience. But the dissociative effects of ketamine actually may enhance benefits and also ultimate results. And this has been seen in psilocybin studies as well. In Griffin's paper in 2011, they demonstrated that psilocybin mystical type experiences allowed for persisting dose-related effects. And so basically the mystical experiences and the psychedelic part actually is part of the treatment of these therapies, and that the profound psychedelic experiences promote improved well-being and mental health. So Lukenbaugh evaluated in 2014 the dissociative side effects of ketamine, and And based on their evaluation using a clinician-administered dissociative states of scale, they felt that the antidepressant results and responses were predicted by the dissociative side effects, and that the more dissociative that the ketamine was, the more robust and sustained the antidepressant effects were. And this was based on 108 patients that they treated. Now, ketamine-assisted psychotherapy involves dose escalation strategies to achieve trance-like states and ultimately full out-of-body experiences. So it's kind of a ratcheting up of ketamine doses to kind of maximize treatment response with psychedelic responses. And so you can use lower doses of sublingual ketamine to get a trance-like experience, or just low IV doses or intramuscular doses. But this allows the individual to be awake and interact with the therapist. Actually, they can speak. Whereas higher doses create this transformational journey, basically out-of-body experience. And in a case like this, the individual would need, certainly the preparatory session to prepare themselves for what's going to be coming, what their intentions are and their goals are. And then the ketamine session itself, where they really wouldn't be able to communicate with anybody. And of course, they need an integration afterwards to kind of discuss what they felt and their new concepts they've developed and what to do with those concepts and any safety-related issues. So ketamine-assisted psychotherapy involves a preparatory session, which involves determining if the patient's a candidate for the treatment, exploring their goals, reflecting on intentions for the sessions, setting expectations, and defining safety in the process. And we want to set the mindset in such a way that they're comfortable, and because the mindset is the set, and that's important for the outcomes during the actual treatment. And then there's the ketamine dosing. And the sessions can certainly be performed intravenous or intramuscular. It can last anywhere from 45 minutes to several hours. And the setting should be comfortable and safe. And talk therapy could be done during or immediately after or the next day when the person has the greatest amount of neuroplasticity. So there's variabilities on when you do the actual talking and the talk sessions during the ketamine dosing. It could be during or immediately after, but you definitely need the integration sessions. And those are important because it improves positive outcomes. It supplies support, integrates insights, and reinforces concepts that the person has basically understood during their infusions. And these are important parts of the treatment process. So the integration is really critical for the person to really consolidate their new gains. Now, what conditions are treated with ketamine-assisted psychotherapy? Well, treatment-resistant depression, bipolar depression, post-traumatic stress disorder, obsessive-compulsive disorder, anxiety, addiction, personality disorders, psychological reactions to physical illness, existential crisis. These are just some of the different issues that are treated with KAP therapies. And there are a number of trials using psychotherapy with ketamine that have been done over the years. We'll just give a couple examples of a few here. There's one with Gravsky and his group in 2022 where they used ketamine with relapse prevention-based psychological therapy for treating alcohol use disorder. And they had 96 participants and basically demonstrated that 3 infusions of ketamine with psychological therapy resulted in more days abstinent from alcohol at 6 months follow-up. So, again, ketamine therapy with psychological follow-up, integration and psychological therapy results in greater outcomes than just basically no therapy whatsoever. And then there's Azari's group, and this study in 2021 using ketamine and basically behavioral treatment for cannabis use disorder, in which they took 8 individuals and gave them ketamine therapies using motivational enhancement therapy, which we frequently use for cocaine use disorder, and mindfulness-based relapse prevention behavioral treatments in a 6-week study. And they utilized either 1 or 2 ketamine infusions during the study. And they found that the ketamine infusions were certainly well tolerated, and that the cannabis use definitely decreased from baseline and stayed reduced throughout the study period of 6 weeks. And so certainly ketamine with behavioral therapy resulted in better outcomes in cannabis-dependent individuals. And then there's also Kropitsky in his studies where he used single versus repeated ketamine sessions with psychotherapy in patients with heroin dependence, and found that more ketamine sessions with ketamine-assisted psychotherapy resulted in higher remission rates or low relapse rates in patients who were heroin-using individuals over the course of a year. And then there's also the question of expanding the length of time that ketamine treatment is effective in depression. And cognitive behavioral therapy certainly can sustain the antidepressant effects of ketamine in treatment-resistant depression. And so the study by Wilkinson in 2021 basically took 42 patients and used cognitive behavioral therapies in at a number of different formats, found that basically cognitive behavioral therapy with ketamine therapy allowed for the antidepressant effects of ketamine to last longer. So again, it's important to incorporate behavioral therapy with ketamine treatments in order to really maintain efficacy of ketamine infusions and ketamine treatments. So the ketamine experience is really of interest to everybody, including the patient. And we know ketamine can be rapid in onset, and as the dose elevates, there is a change in the ability of the individual to communicate. Their therapeutic sharing decreases. So they can't tell you a whole lot what's going on. So at lower doses, you can certainly have more conversations and more therapy, but at higher doses, less of that occurs during the actual experience of ketamine. But initially, patients will notice they get sensory effects. They feel basically numb all over and heavy. But then a lot of them will start to feel connected to things. They'll feel loved and appreciated. They'll have this fluid connectivity that just changes. And it creates these novel experiences. And then eventually they feel like their mind is free to roam and roam around or roam within. And sometimes they can stand outside themselves and look at themselves and kind of analyze themselves for what they are. And of course, there's also heightened visual and auditory perceptions. And then there's decreased verbal thinking. Individuals think more with colors and synesthesia, the ability to taste the color red and hear the color green. And these individuals will have little ability to actually direct the experience, which basically, can be a problem for some people when they set an intention before they go in, and then suddenly their brain goes a different direction. They have to recognize that that wasn't a failed experience, but rather that's what ketamine does. It takes you in all sorts of directions. And also ketamine allows people to step away from their obsessional thoughts and circular thinking and dysphoria or low mood. And as doses get higher, certainly out-of-body experiences can happen. Time distortion, people lose track of time, they float, and they kind of sense that they are small relative to the universe. They lose themselves in time and space, but yet at the same time they feel love, empathy, and connectedness. Yet they feel formless, and yet they have this cosmic awareness of a greater consciousness, a lot of contradictory thoughts. And then some people get spirituality or religiosity. And then some people feel like they're stretching or shrinking, or that they become part of an object near them. And so basically individuals start to feel more positive about themselves over time. They have higher peaceful existence and self-appreciation and self-acceptance. And of course, some will develop a renewed sense of the self. They kind of forgot how they used to feel, and they had just been depressed for so long. Now they start to feel better, and they have this renewed sense. And this also allows them to put trauma in the past and create peace within themselves. And then ketamine therapies also will reduce negativity, the negative side of the brain, so that they have reduced negative self-thoughts and self-sabotage. And they trust themselves more and trust that they're not going crazy. They don't fear that they're going crazy anymore. And overall, they have decreased symptoms. And they create this learning experience from the sessions, and they bring new perspectives and a directed ability to see themselves in new ways and for a new future with new mental foundations that's clear and strong and resilient with psychological flexibility. So the experience of ketamine and KAP therapy varies by the dose and the duration. It varies by the route of administration. And so in various experiences, you'll get kind of this time out from your ordinary life and expanded mindset. You'll get this access to this larger sense of the world and yourself, and that there's more out there, and that you're part of something bigger that's important, and that you're playing a role in it. And you feel basically fewer negative emotional sensations. and you feel more engaged after the session because you're more flexible psychologically. You feel like you can consider new things and new opportunities, new learning. So ketamine assisted psychotherapy, generally you'd start at lower doses of ketamine because you want to kind of put the person in more of a state of trance so they can communicate with you, communicate with the therapist. And at this dosing, they get relief from their obsessional concerns. They begin to be more attentive to themselves and the therapist, and they can redirect that inner healer and integrate the healing state and the sense of newness. And they can self-reflect and have guided meditation. And this really allows for a certain sense of healing and direction that, the individual, as they're going through this therapy, is more vulnerable and more open to, new learning and suggestions. And so this is really a critical time where KAP therapy plays a key role. And so doses of ketamine that could be used, if you're using, for example, sublingual doses, anywhere between 50 and 400 milligrams may be used. And the onset's about 15 to 30 minutes later, and the effects can last anywhere up to an hour or even longer in some individuals. And then there's the higher dose ketamine therapy. And so KAP therapy with this, there's more out-of-body experiences and ego dissolution. The individuals don't talk, they just basically stare or don't move. And this is more transformational. And this is an altered state of consciousness where the individual has more visual and tactile distortions and auditory perceptual changes and inability to really verbalize the experience. And this is generally done through IV dosing or IM dosing, where the doses can be anywhere from 40 to 130 milligrams, and symptoms can last for 60 minutes for some individuals. And so the setting plays an important role in guiding the psychedelic experience and promoting a sense of warmth and safety. And this was written about with Carhart Harris in 2018, where in psychedelic use, there's a huge essential importance of the context with which the treatment is administered, because that can affect the outcomes. And the overall results of KAP therapy are quite impressive. Certainly there are adverse events like nausea, vomiting, and agitation less than 5%, but about maybe anywhere between 5 and 10% get nausea and maybe some vomiting, which can be prevented. But we know that KAP therapy significantly decreases anxiety and depression, especially with prior trauma histories, especially individuals who are older and those who have higher Beck depression inventory scores or post-traumatic stress disorder or higher ACEs scores where they had pediatric trauma or suicidality. Those individuals have the highest responses to KAP therapies. And in general, we see individuals with improved depression, anxiety scores, well-being scores, PTSD improvement, and improved alcohol and drug scoring with KAP sessions. It's noted that more KAP sessions are certainly better, and higher dosing can certainly be better for some individuals, but frequent KAP sessions have huge benefits. And the psychedelic and dissociative effects of ketamine play an integral role in KAP. So don't fear the altered states of consciousness because they are therapeutic. And the effects of KAP are really seen across a range of ketamine doses and diagnoses. So again, a number of diagnoses have been treated with KAP therapy, and a number of doses have been used in different manners. So we see multiple effects with KAP. So it makes it hard to really evaluate all the studies and apply them all and cross them over to just traditional medical ketamine treatments. But that said, applying the psychotherapy certainly makes a huge difference in consolidating all the gains. Now, ketamine can be administered every 2 days or on a periodic basis per the patient's needs. And multiple sessions of KAP therapy and ketamine treatments allow for longer term results and better outcomes. And also it may increase the number of positive results in patients who are ketamine resistant. So sometimes they need more treatments and they need higher doses to make them respond. And the ketamine experience overall is very well tolerated. There are very few dropouts and no real physical dependence has been seen in clinically used ketamine. There are no cravings, few side effects, and this really allows for episodic use of medications versus the traditional antidepressants that you have to use every day. And also the great thing is home therapy is available. You can use home ketamine for basically sublingual treatment or intranasal to help maintain effects. And again, the best results are seen in patients with the worst initial symptoms, the high Beck depression inventory scores and high ACEs score and suicidality. Those with the severe symptoms have the best KAP results.